The New Coronavirus, read to you by Carol Brigham. In January, the world learned about a new kind of illness, a new coronavirus. It is very contagious. The new coronavirus has symptoms similar to the flu: fever, cough, sore throat, and weakness. It can develop into pneumonia. The new coronavirus may have jumped to humans from animals such as bats or snakes. These were for sale at a food market in Wuhan, China. The coronavirus spread from person to person in Wuhan very quickly. More than 60,000 people in China had this illness by mid-February. When people from Wuhan traveled, the illness went with them. It spread to more than 24 countries. How does the virus spread? The virus can travel from person to person through droplets in the air when people cough. Viruses can enter a person's body through the nose, mouth, and eyes. They can stay on things a sick person touches. People have never had this illness before, so we don't have any immunity to it. The government of China has done many things to try to stop the coronavirus. It canceled Chinese New Year celebrations, sports events, concerts, and other gatherings. Schools and movie theaters closed. China quarantined the entire city of Wuhan and then 11 other cities. No one was allowed to leave the cities. People had to stay in their homes. Wuhan built 2 temporary hospitals for people sick with the coronavirus. World Health Emergency. When the coronavirus spread to other countries, the World Health Organization, WHO, declared a global health emergency. WHO says that this virus is dangerous, but there is a good chance of stopping it. Doctors need to learn more about the coronavirus. What medicines can treat it? How quickly can they make a vaccine? Many people recover from the coronavirus without any medical treatment. Other people may have the virus and never know it. They can spread the disease, however. In the United States. In January, the U.S. Centers for Disease Control, CDC, declared a national health emergency in the United States. At airports, nurses test people who have arrived from China. These people must stay in quarantine for 14 days. Many airlines canceled flights to and from China. Non-Americans who have traveled to China in the past 14 days may not enter the U.S. There were 16 cases of the coronavirus illness in the U.S. as of February 13. Economic problems. This new illness is affecting the world's business and trade. For example, Chinese factories make many of the auto parts and electronic things that are needed in other countries. Chinese tourists have stopped going to other countries. Flu season in the U.S. It is not likely that there will be an epidemic of the new coronavirus in the United States. However, October to March is flu season in the United States. Every year, there are many people who get sick with the flu. They have fever, sore throat, muscle aches, weakness, chills, headache, runny nose, and cough. Most people who get the flu don't need medical treatment. They stay home, rest in bed for a week or more, and drink lots of fluids. In the past 4 months, 26 million Americans have had the flu. Last year, 34,200 people died from the flu. Doctors treat bad cases of the flu with antiviral medicine. Preventing the flu. The CDC recommends that most people get a flu shot to prevent the flu. Avoid crowds. If anyone is sneezing or coughing around you, move away, far away. Wash your hands after touching public doors, public stair railings, or toilet flush handles. Wash your hands after sneezing, coughing, or using the toilet. Carry a little bottle of hand sanitizer with you. Push public doors open with your elbow. Use a paper towel to turn door handles. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home when you are sick. Cover your cough or sneeze with a tissue and throw the tissue in the trash. Have plenty of food and healthcare supplies at home so you won't have to go out to get them if you become sick with the flu. If you become ill with the flu or coronavirus, stay home. Drink lots of fluids, juice, herbal teas, and chicken soup. Rest. Call your healthcare professional if you have a high fever or feel very sick. People who are at high risk should take flu antiviral medicine quickly if they get sick. To subscribe to Easy English News, and for more information on free supplementary materials and other works by Elizabeth Clare, visit our website, elizabethclare.com.